In this session, we will build upon the purpose statement and the aim statement to develop your needs assessment. The components of a needs assessment vary from research grants to educational grants, yet the focus is the same. Why does this work need to be done, and how is it linked to current standards and identified needs? We began by developing the purpose of our project. The needs identification informs the methods you will use to address your identified needs. Your outcomes will measure your success in achieving your purpose. Let's begin. A needs assessment generally includes 4 elements: the environment, evidence-based standard, current situation, and people. The environment sets the context and provides a background of the problem. It describes the state of play, existing research and work done in this area, and the status quo that your project intends to change. While it's an essential part of your grant, an environmental overview shouldn't overshadow the more critical aspects of your needs assessment: the evidence-based standards, the current situation, and the people. Evidence-based standards refer to the established norms or standards that serve as benchmarks in your specific area. They can be drawn from professional guidelines, care plans, pathways, and recommendations from professional associations. The current situation assesses and describes the present status or existing condition, contrasting it with the established standards. Both qualitative and quantitative sources can describe this current situation. The people section describes who would benefit from your project, the target population, learners, patients, and others. Understanding their needs and situations is key to designing a project that's fit for purpose. Our focus through the needs assessment is identifying the gap between what is the current situation and the evidence-based standards. Closing this gap is the focus of our work. Let's consider data sources you might use to describe the environment, standards, current situation, and people. The environmental overview generally includes a literature review of journal articles, public health reports, and government data that offer an overview of the environment within which you're working. The evidence-based standards include clinical guidelines, evidence-based care, including care pathways and government policies. Professional associations may often contribute to and support these standards. The current situation includes both qualitative and quantitative data sources. Quantitative data include publicly reported data, hospital reports, discharge records, clinical registries, tests ordered, clinic and pharmacy data, insurance or other claims data. Other data sets may be available in your specific situation. Qualitative data helps you identify the impact of attitudes, barriers, culture, and personal practice on your needs assessment. Sources of qualitative data include interviews, focus groups with clinicians, patients, or other stakeholders, or survey data from clinicians, their teams, and your patients. We identify the needs of specific people: learners, subjects, patients, caregivers, the community, the broader public. Which patient will benefit? Who are the target learners? Keep in mind that needs are local to your learners. A clinician in a coastal, well-populated area may have very different needs than someone in a remote, mountainous area. A staff physician from a large academic health system may have very different needs than a physician working within a rural clinic. Be sure you understand the gaps locally to your learners as well as your patients. Your goal in the needs assessment is to decide who your target learners are, understand their actual and perceived gaps, then develop an educational strategy to close the gaps you've identified. As you develop your needs assessment, you will consult multiple sources to identify and describe the gaps you are addressing. Those sources include guidelines, evidence-based standards, perceived needs, interviews, public health data, anything that helps describe what is and what ought to be. Best practices in developing a needs assessment include creating the linkages that demonstrate why this project is needed, including multiple sources, addressing the local needs. Be inclusive but not exhaustive. Grantors don't want to read an extensive needs assessment program, particularly if it exclusively includes literature. Provide relevant references. Provide relevance for your population. And link your needs to your outcome strategy. We'll have more on that later. A needs assessment worksheet is available in the Learning Center. Use this to capture the components of your needs assessment. A comprehensive needs assessment clearly describes the gap you will address. The next section will cover the different types of gaps that you may encounter. Thank you for your participation in this needs assessment video.